Everyone has times in their lives when they feel fed up or miserable. It's usually for a particular reason, doesn't interfere too much with daily life, and doesn't usually last longer than a week or two. However, if these feelings go on for weeks or months, or become so bad that they start to affect every area of your life, you may have depression. If you're depressed, whether it's mild, moderate, or severe, you'll probably notice some of the following symptoms. In your mind, you feel unhappy, miserable, down, depressed. This feeling just won't go away and can be worse at a particular time of the day, often first thing in the morning. You can't enjoy anything and you lose interest in seeing people and often lose touch with friends. And you can't concentrate properly and find it harder to make decisions. You lose self-confidence, you sometimes feel guilty and unworthy, and you become pessimistic and feel hopeless and sometimes even suicidal. In your body, you may find that you feel restless or nervous or even agitated. You feel tired and have no energy, and you can't get to sleep or sleep too much or wake early in the morning and or throughout the night. And you often lose interest in things like sex and eating, and you often lose weight, or for some people, they comfort eat and put on more and more weight. Other people may notice that you make mistakes more at work, or you're just not focusing the way you normally do, or you seem quiet and more withdrawn, and you're avoiding people. People may notice that you worry about things more than usual, or you're more irritable than usual, or you're complaining about vague physical problems, or you stop looking after yourself properly and you're not washing your hair or your clothes, or even looking after your home properly. You stop cooking, you don't tidy, or you forget to change the sheets on your bed. Most people won't experience all of these, and some people may only be aware of the physical symptoms. I can't tell you the number of people I see that think they have a physical problem only to realize that they're depressed. In fact, physical symptoms like this are usually the first sign of depression. This is a daily occurrence in my clinic. Sometimes it's difficult to know how depressed you are, especially when it comes on gradually and it sneaks up on you. People often try to struggle on and may even start to blame themselves for being lazy or lacking willpower. It often takes a friend or a partner to persuade patients that there really is a problem and suggest that you seek help. It's useful to be aware of the signs of depression. They're not always obvious, and people of course put on a brave face because they want to or feel they have to. If you do know someone who you think may be struggling, a concerned and kind word, even offering a sympathetic ear, really can and does make all the difference. Depression isn't a sign of weakness. It can happen to the most determined of people. Even famous people, famous athletes and celebrities can experience depression. There will often be a clear reason for becoming depressed, but sometimes not. Common reasons I see in clinic every day include things like life events and personal circumstances. Depression can often be triggered by a stressful or distressing event, such as a death in the family, a relationship breakdown, or work-related issues. If your life circumstances mean that you live alone or have no friends or family around, you may be more likely to become depressed. Physical health problems, particularly those that are serious or long-term, can also cause depression or make it worse. These include things like life-threatening illnesses like cancer and heart disease, long-term and or very painful illnesses like arthritis or other chronic diseases, or viral infections like flu or glandular fever, particularly in younger people, or hormonal problems like an underactive thyroid, or conditions affecting the brain or nervous system. Some people may be more vulnerable to depression than others. This may be because of difficult childhood experiences or trauma, which can include abuse, neglect, witnessing violence or a traumatic event, or even a very unstable family environment. Regular heavy drinking or using drugs like cannabis can make you more likely to become depressed in the long term too. Depression can run in families, and we see this often. If you have one parent who's been depressed, you're more likely to become depressed yourself. Men who experience depression are less likely to talk about their feelings and are less likely to ask for help. They may express their depression in a different way too, through sudden anger or increased loss of control or greater risk-taking and aggression, as well as using alcohol and drugs to cope. Men are also much more likely than women to die by suicide. For women, around 12% of pregnant women experience depression during their pregnancy, while about 20% will become depressed in the first year after having a baby, so-called postnatal depression. People who are transgender, non-binary, lesbian, gay, or bisexual also have higher levels of depression and have a higher risk of attempting suicide and self-harming. The good news is that most people with depression do get better on their own or by doing things to help themselves, but some people do need extra help, especially if their depression is severe or it goes on for a long time or the things they've tried to get better haven't worked. So if you think you need to talk to someone about how you feel, try not to put it off, as it can help you get back to doing the things you used to do and enjoying life sooner. And this is really the take-home message. If you're feeling low and you just can't snap out of it, or you're thinking of harming yourself, do seek help from your GP or the emergency services if your life is in imminent danger. Patients often have depression for months before they seek help, and when they do, they always kick themselves for not seeking help sooner. In my next video, I'll talk about the things you can do to take control of your mood and your life. Till then, thanks for watching and stay healthy.